Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Wounds. So what is wound? Wound is a breach in continuity and of the skin surface or the skin surface epithelium. Next, what are the classification of the wound? So classification is, the wound is, there are 4 classes, the class 1, class 2, class 3 and class 4. So first is a class 1, which is nothing but it involves the clean wound, and the description being it is an uninfected perforative wound without inflammation, so it is without the inflammation. Next, what are the examples? It is uninfected surgical incisions, and there's respiratory, alimentary, genital, your urinary tracts are not entered. So respiratory, the alimentary, as well as the genital and the urinary tract, they are not entered. Next is class 2. Class 2 is where the clean contaminated wound. So as per this clean contaminated wound, the operative wound with a controlled entry into the respiratory, GI or the gastrointestinal tract. So examples being the cholecystectomy and the elective colon resection. Next is elective gastrectomy. Then comes the class 3. Class 3 is nothing but the contaminated wound. It is an open, fresh, accidental wound. Major break in the sterile techniques or acute non-purulent inflammation is encountered. The examples being appendicular perforation in emergency surgery. Next is gastric perforation in emergency surgery and unprepared bowel. Then open fractures as well as the open cardiac massage. Last is the class 4. The class 4, it stands for the dirty wound, and it is the old traumatic wounds with retained devitalized tissue. So it is an old traumatic wound with the retained devitalized tissue, clinical infection and perforated viscera already present associated with severe inflammation. Then comes the examples being the perforated diverticulus and the fecal peritonitis, necrotizing soft tissue infection and the presence of the frank pus. To learn and grow daily like this, please do subscribe.